Well, good afternoon. Thank you for being here today. We are gathered here today on the traditional territory of Treaty 6, and I also want to acknowledge the Métis people who share a deep connection with this land. Earlier today, we learned that the UCP tampered with the Alberta Health Service's fall immunization campaign, directing the removal of the word influenza and the word COVID from advertisements. Now, these campaigns are designed to inform the public of the availability of vaccines for them, to outline the benefits for individual immunization during times when we see higher rates of respiratory illness in the community, but the UCP demanded that information be removed. They wouldn't even tolerate a simple encouragement for Albertans to book an appointment to get their shots. Now, a proper, vigorous fall immunization campaign could have saved lives and saved millions in costs to the healthcare system. That could still happen. But instead, it seems as though Danielle Smith and Adriana LaGrange remain more interested in saving themselves from losing political ground with their anti-vaccine base, when they should be letting Alberta Health Services conduct an informative and proper vaccine campaign to support the Alberta public. Now is not the time for message tampering and ideological warfare. Now is the time to equip Albertans with the resources they need to make informed decisions about their health. Everything we're seeing in healthcare right now, patients being cared for in hallways, triple bunked rooms, delays to kids' chemotherapy treatment, the chaos, pressure, and indignity for patients and healthcare workers is because the UCP has chosen to let things get worse than they had to. It appears the UCP's goal was to provide as little information as possible, health information that is designed to keep Albertans safe, healthy, and out of hospital. Do your own research is not a public health strategy. It is the mark of a government that's abandoned one of its core responsibilities to the people it was elected to serve. Removing government logos on important public health announcements minimizes their significance. The UCP knows this. Omitting information about the specific immunizations that will protect people is not only confusing, it is misleading and deceptive. The UCP's actions are directly putting Albertans at risk. Now, in their update today, Premier Danielle Smith and Adriana LaGrange offered at best a mixed message. Let me be clear. Providing stabilization funding to help family doctors keep clinics open and staff in place is the right thing to do. In fact, it's a step that other provinces took over a year ago, one I've been calling on this government to take for months. But despite a $5 billion surplus, despite having millions to subsidize a millionaire hockey team owner in Calgary, despite being willing to blow over $70 million on low-grade children's Tylenol, most of which will never be used or never arrive, the UCP have dragged their feet, while family doctors grew increasingly desperate and many were forced to choose to leave the profession of the province. So I find it hard to praise the UCP for this decision today. And let's not forget, they created these circumstances. One of the first moves by the UCP government was to wage war with family doctors. And now, after the UCP ripped up their contracts, blew up their payment structure with the province, made it harder for family doctors to provide comprehensive care to their patients, Danielle Smith and Adriana LaGrange still don't have a payment structure that family doctors say works. Instead, family doctors remain buried in additional costs, more red tape, and added administrative burden that gives them limited time with patients and limited time to address complicated cases. And instead of action, the UCP's answer has been endless committees, task forces, rehashing conversations on the same issues that have existed since before they blew up primary care in 2020. Dr. Paul Parks was the only person at today's announcement that described what doctors are facing in hospitals, what Albertans seeking care are dealing with, and to state clearly that vaccines are an important tool to protect you and your loved ones. Danielle Smith said she values family doctors, that she considers them partners well. If that were true, then her and Adriana LaGrange wouldn't be continuing to make doctors' lives harder and put their and their patients' lives at risk. They would be taking real action to support family doctors and protect public health. Thank you. I'm happy to take any questions.
We'll now open up to questions. For those joining by Zoom, it's the raise hand function or *9. Please state your name and affiliation off the top. We'll start with questions in the room. We'll go to the questions online.
I was just wondering, when it comes to them not using that specific language, the Alberta government is saying that their vaccine rates are comparable to previous years. I'm just wondering what your response is to that.
My understanding is we're seeing some of the lowest rates for influenza vaccinations that we have seen in years. And certainly that is what I'm hearing from frontline doctors and other experts. I can't say this is a government that I ever quite trust them when they start putting out numbers. They're very fond of cherry picking, miscontextualizing. And I think the impact we're seeing on the ground is clear. Doctors on the front lines are talking about this being as bad as some of the heights of the pandemic. So frankly, I think this is the government making excuses after they have been caught intentionally working to weaken and undermine the vaccination campaign that Alberta Health Service was putting forward this fall. What we are seeing out there now is in part due to this government's interference, their anti-public health stance that they're putting forward for political reasons. I think they deserve to be held to account for that.
Do you have a follow-up?
Yes. I also wanted to ask your thoughts. Previously, we would maybe see the Chief Medical Officer of Health help launch the immunization campaign, and we just have not heard from our current Chief Medical Officer of Health, and I'm wondering what your thoughts are on that. We haven't heard from him through all of this, even with vaccination numbers and influenza rates in hospitals and things like that.
Absolutely. Speaking to these issues is one of the primary jobs of the Chief Medical Officer of Health, for them to speak to Albertans, provide information, provide context, and make recommendations to support the protection of public health. But what we have seen is this is a government with a repeated pattern of working to take control over public health. And that includes, it seems, communication and messaging away from the medical experts and put it in the hands of politicians. We have seen that with their firing of Dr. Dina Hinshaw, replacing her with someone now who he's hardly ever allowed to set foot in front of a microphone. We've seen that in how they have chosen to begin to hide so much more data about the situation on the ground. We have seen that in them passing legislation that is unprecedented in Canada in terms of giving cabinet power over every single health decision, veto power over every decision made in public health, whether that's a food inspector on the front lines or made by the Chief Medical Officer of Health themselves. This is a government that is now restructuring the entire system to consolidate even more control in the office of the Health Minister and the Premier, and we see it now when the Chief Medical Officer of Health is nowhere to be seen. And instead, we have the Premier and the Health Minister shamefully obfuscating and not even being able to speak out in favor of the simplest intervention that is available to us that could be saving lives, saving us pressure and costs in the healthcare system, that being scientifically proven vaccines. So I'm deeply concerned for what this is going to mean for Albertans going forward, as they have more and more control over politicians, more and more control over their health is in the hands of politicians instead of the medical experts who actually know what needs to be done.
We'll do one more pass for questions. Again, those joined by the Zoom is the raise hand function or *9. Seeing none, that concludes today's press conference.